Thank you very much. The chief guest, representative of the minister, OI Deputy Director, Dr. Monique Keloa, Government CEO, Peter Jeffries, representatives, AU, IBA, FAO, ladies and gentlemen, all delegates, good morning. I'm very excited to be part of this occasion today, and I'm quite happy again that the first three speakers actually saved time, so I'm at least comfortable. I have some time to joke around with, but I'll not mess it up. Let me say I'm very excited to be part of this occasion. As it has been said, this is the first time ever in the world that OIE has actually partnered with veterinary paraprofessionals to organize and execute a conference of this magnitude. That's not to say that OIE has never been discussing veterinary paraprofessionals. They have done it in the past. AU IBA has done it in the past. But this was being done in the absence of veterinary paraprofessionals themselves. So we are excited that this one, we are actually part of it in the organization and execution. Ladies and gentlemen, as a continent, we are blessed. We are blessed by the land. We have a massive piece of land, 1.2 million square miles, that's Africa. We are blessed with the waters around and within. We are blessed with the pasture. As Africa, we are blessed, and we are actually a hotbed of a very vibrant veterinary paraprofessional profession. If, for your information, even as we are speaking here, veterinary paraprofessionals, some of them from South Africa, today are actually giving presentations in Geneva on issues related to livestock development in the world. That means that the veterinary paraprofessionals profession in Africa is actually very vibrant. However, ladies and gentlemen, it's very unfortunate that we have never benefited from this. And this is because of the weak linkage between veterinary surgeons and veterinary paraprofessionals. It is so weak that if we never checked it, or if it is not checked, and I'm happy that we are meeting here today, then it will go to disaster levels. And this in the past has resulted into deficient animal health systems, defective disease control measures. We are not able to control diseases in Africa. We talk of foot and mouth every day, day in and out. We expected that after 50 years, at least universities would be finding difficulties to get animals for practicals, but it is not difficult because all the cases of diseases, you can actually find them next door. Inappropriate policies in Africa for livestock, and this is simply because the policies which we develop in Africa for livestock development are actually based on assumptions. We assume a lot. We assume that veterinary surgeons are all over. We assume that farmers and livestock keepers have the capacity to pay for the services. And we even assume that animals can wait for days to be treated. Lack of or unimplementable pieces of legislation has resulted because of these weak linkages. And finally, the weak institutional framework. The livestock farmers and keepers in Africa are therefore left to find for themselves. They are really struggling to get some of these services. They can't access them. And that's not to say that we don't have persons who are skilled. They are there, but there are roadblocks before the farmer can reach them. There's a roadblock of very big legislative documents, very crafty policies, and this has actually taken us behind as Africa. Ladies and gentlemen, more often than not, whenever we fail as a profession, that's me and you, we normally blame governments for insufficient funding. We say that our governments are not actually giving us enough budgetary allocation. And that is not the truth, because it is us as a profession to justify why we need 100 billion. There's no government in Africa that has money somewhere. You just ask for it and you'll be given. But unfortunately, we have never been able to justify why we need all those resources. And for a very simple reason, that the veterinary paraprofessionals are not involved in budgetary processes. If they can be involved from the village level, then the justification at the village can be carried up to the ministerial level. This conference is therefore very timely and further complements efforts which have been done by several institutions. AUI is doing a lot. Government has done several other programs. East African community are doing so much, and this conference actually complements that.